We had a young female, she's got some multi-digit paresthesia. She has to get some chest pain as well anytime using stuff above her head. So thinking thoracic outlet Doppler. Straight away on the pulse wave, we know there's some pretty significant compression. Now, if you've got the luxury of this probe, this is the XL143, it's a 4D volumetric scanning vascular probe. It's pretty sick. And it makes your job much easier. So it's quite hard to get your camera in the right spot sometimes and get the angles right. So in this case, we can kind of just sit that camera infraclavicular so we can see that costoclavicular space without moving the probe, and it'll just take a fanning volume. And then we can go through and take the slices that we like. Wabam! The compressive artery going over that first ribs. It's that really narrowing of that artery. And this is in that abducted position. So that volumetric scanning just kind of making our life much, much easier. Another take home is that when we're assessing in 2D and we're using the vascular probe or whatever probe, oftentimes when we're in that position, that artery turns into a crescent shape and it's hypoechoic internally, and it looks like there might be some patency to it. But when we actually chuck on the new hockey stick, we can see that inside that crescent shape, it's actually the intima, opposing intima are touching. So we've got that white line. That's actually completely occluded. So it might be falsifying to think, oh, it's actually a little bit open, but with the new hockey stick, you can actually see that it's completely opposing lumen. Elastography of the brachial plexus, because, why not? Just to see if there's any fibrosis that's detectable in that brachial plexus from that chronic compression at that space. This is kind of still in the research world, so, watch this space.